we're being told that, according to what the international reports are, the outbreak in West Africa could get worse, and that's according to a U.S. public health official. Well, he's there and he's making all that. And the gentleman's name is Tom Frieden. He's the director for the Centers for Disease Control, and said the epidemic would need an unprecedented response to bring it under control. And so far, the World Health says that we have 1,427 people so far killed. The responses and the way our public health officials have responded to it, would you say you're happy?
I think, first of all, I will not be able to speak for other countries that have been affected, even though this conference is supposed to be a regional conference of the various West African states. And when it comes to Ghana, I would say, you know, the first time we heard about Ebola was somewhere in March. And I did chastise government for the efforts that was put in place when it comes to public education and stuff like that. And I did make reference to South Korea. South Korea, as of April, when this Ebola menace broke out, had instituted mechanisms to more or less check people from all African countries. They had restricted flights to certain parts of West Africa, and they even had cameras to monitor people who were quote and unquote showed symptoms of this sickness. But I think as a country, for now, we are doing somehow well. Why am I saying this? Because if you look at the breakout of this sickness, I mean, you look at our neighboring countries, at least Ghana, since March, we've been able to do well to prevent it. If it's through miracle or through our efforts, that's a different thing. But at least we've done something. Because I did hear the GMA, which is an official body and well positioned to make a comment that is of validity, did say that even though they expect government to do more, they think government is doing well, is making the effort. And if you look at this whole ministerial meeting that is supposed to be chaired by the president today, I think it's today, right? The whole essence of this meeting is supposed to more or less to take stock of what happened or what proposals they put in place, especially when the various heads of states in West Africa did meet somewhere, I think in July, right? That was in July, to take stock to see where they are, what can be done to improve the situation. And I think it's in the right direction because, look, this Ebola issue is not a country issue. It's become a regional issue. Because you look at our neighbors like Liberia. Liberia is seriously hammered by this Ebola sickness. You go to Sierra Leone. I mean, today we are even told that even DR Congo, which is far somewhere, is also affected. You go to Nigeria. So I think it needs to be a regional collaboration. And before we started this program, I saw your program did what do they call it, a commercial. And I think the various private media and private organizations are also doing very well when it comes to the sensitization. But I think the most important thing that we need to more or less put much emphasis on should be prevention. And when it comes to prevention, even though there have been some calls from some quarters that, look, we should ban traveling and all these kind of things, I don't know if that is going to address the issue, but we have experts who are in a better position to address it. And today, as we speak, this meeting, I think, will come out with some of the modalities and mechanisms to address it. But so far, so good. Even though I wouldn't say that it's the best, because I do not have the expertise to pass a judgment. But since we haven't had one, and since we have certain measures being put in place, I think government should be commended for now.
Well, Ebola is a major crisis for us, in the sense that as at this morning, what I heard was that even for the 3 countries who are known to be worst affected, they're likely to lose $13 billion as far as their economies are concerned. So it's a major thing. And one person getting infected can cause so much panic and create so much crisis that it's good that we make every effort to address it. It's just unfortunate that we seem to be a bit casual about this whole process. Why do I say so? 10 patriotic Ghanaians have reported that they came from Sierra Leone on a mining trip and nobody screened them. So they were wondering what was going on. That's what we were expecting the authorities at the airport to do. That we are back from a country which is known to have serious Ebola crisis. And then we enter our own country, maybe because of our appearance, everything, we just go through. Knowing very well that...
Because they are looking good.
Yes, knowing very well that our passports showed where we were coming from. So it's worrying if indeed, so they said immigration was going through the process to find out what happened, why it happened. But God knows how many people would have gone through this and not reported to anybody. I was speaking to one member of ECOWAS Parliament from Ghana, and what he said was that, I only thank God you would have heard that I was gone, because a member from Liberia got to the Nigerian airport and Lagos airport, collapsed, and then all those who got into contact with him had Ebola, and some medical people had even died.
Yes.
If the person had traveled further to ECOWAS Parliament, where all of us would have engaged him or had contact with him and would not even have known that he had Ebola, all of us would have been in trouble. So that's how serious the matter is. And we really need to take serious steps to make sure that, one, so far, Noguchi has insisted that so far they have not been able to test anybody as having Ebola, and their systems are credible enough so that we should not panic. But we need to show that indeed, if anything should happen, these are the steps that we've taken to ensure that it doesn't spread, because it has all its own repercussions. Travel ban, economic impact. They said, Liberian people are refusing to go to work. They rather stay at home than to...
Because the disease is that contagious.
Yes.
That's a
to mingle with people. So they're avoiding public places. And how can any nation survive by imposing a curfew on itself?
Ahmed, while commending health officials in the public health service, let's say the Ghana Health Service, for perhaps taking instrumental measures to make sure that, well, we are cautious enough, you speak to the public health officials, the medical doctors on the ground in the various key health facilities. They tell you, for example, the containment centers are readily not available. They're not ready. And we're supposed to have 3, one in Accra, one somewhere in the Middle Belt, and one up north. The point is, we've had a lot of talk and a lot of discussions on the subject, but practically on the ground, you have constant interaction with public health officials, and there seemed to be that phobia or that fear and that very anxiety that, well, despite all the goodwill, it hasn't translated to practical things on the ground.
I think I agree with you. And if you remember, I did start by indicating that this whole Ebola issue broke up somewhere in March. And as of March, or even as of June, July, we didn't even know whether most of the health facilities even had these gadgets that they had to wear. And if you remember, I think the president or somebody from the Ministry of Health did indicate that government has issued money for the purchase of these materials, and that was about a month or at most 2 ago, you know. And if you talk about these 3 quarantine areas where they are supposed to use to quarantine people, this announcement was made about a month or 2 ago. So definitely, these facilities will not be ready as we speak. But as I did indicate, even though it's as small as it is good that something is being done, because we are being told that now, as we speak, these gadgets have been purchased. And if you remember, there was an officer from Ghana Immigration Service who did indicate that out of the 42 entry ports to Ghana, only 4 had some semblance of. So at the end of the day, what I'm trying to say is that even though it's little, it's better than none. And as the MP rightly said, I think we need to take this more seriously, because it's very unfortunate and quite regretful that you have people coming from not just outside the country, but an Ebola-stricken area. And it's not just about the Sierra Leone issue. I also heard people talk about they coming from Liberia, and it's a fact. It's a fact. And I strongly believe that, look, in most of these things, I think we shouldn't leave the responsibility with only government. We shouldn't leave the responsibility with only government. Because why am I saying this? You have public health officials who are Ghanaians, who, when such things happen, they are going to be affected. But they are at the airport and they do not have the gadgets, and you interview them and they give you a different story. You understand what I'm saying? You have immigration officers who are supposed to more or less be protected, and they are supposed to do their job. Government says that they have been given the equipment, and you interview them and they say that yes. You get what I'm saying? So what I'm trying to say is that at the end of the day, this is not their responsibility, even though it is of government. It is a national responsibility.
So it's a stakeholder effort.
It's a stakeholder effort. That is why on Joy TV is airing an advert maybe for free. You understand? So at least everybody
it's a publicity material.
Yeah, that is it.
So usually
it's not for free,
the promotions are what you pay for.
Yeah,
so
but what I'm trying to say, everybody needs to be involved. Each and every Ghanaian has what? A responsibility to try as much as possible to do in his own way to prevent this. But we should not in any way try to create fear and panic. And that is why I bemoan the situation whereby every single suspicion of Ebola at every hospital, then it comes in the dailies. And when Gucci comes out with their report, then it becomes negative. I don't think there's the need for fear. There needs to be genuine concern and genuine commitment in trying to prevent this menace.
I get your point. Not to create fear and panic.
Yes.
Because some of the reports also have bordered on the lines of being more speculative than being real, because they have been authenticated.
Yes, and then we have to be realistic enough to admit that our health system is not in the best of shapes. Yes, because look at what cholera is doing to us.
Because I'll just come into that very subject.
I mean, if we cannot contain this, what is supposed to be quite an ordinary disease, then what happens if we should be stricken by Ebola? I mean, we have to devote a lot of resources into our health system. We have to see this as emergency and then take steps to address it than to let it look like it's an ordinary thing, because when it hits us, we are in serious trouble.
Okay, and so